Mary Jo, Pam, welcome to Dateline Delta and Behind the Scenes. We're in the dental area here at Delta College. And could you tell us about the dental programs?
Sure. Dental hygiene is a 2-year program. It's 5 semesters and it's full-time. And the students learn numerous procedures and treatment and how to handle patients. Many things throughout the program that they have to reach competency on. And at the time they graduate, they have earned an associate's in the science of dental hygiene.
Dental assisting is a 1 calendar year program, but we also offer it as a part-time option for those students who feel that they need to work, have family obligations, and that would make it a 2-year program. Once they are completed, they're able to sit for the national certification exam and the state licensure exam in the state of Michigan. That would allow them to do expanded duties such as placing and carving amalgam restorations, making temporary crowns, pit and fissure sealants, fluoride treatments. It just makes them a more productive member of the dental team.
You talked about the dental team. What kind of jobs would graduates tend to get?
Well, the dental hygienist could be a clinician in a private practice, a general practice, a specialty office, or they may choose to go into public health. After they gain a few years of clinical experience, they may want to expand into research or sales, consulting, teaching, all different types of pathways that are available, or managing offices and things like that.
In the same token, dental assistants can do pretty much the same thing, same pathway. There's a wide variety of opportunities. And one of the extra opportunities is serving in the military. They can actually join the military and use that credential to be an assistant in the military. And also they can be a civilian on a military base.
And here we are in the new lab at Delta. Can you tell us how that's enhanced the teaching?
Oh, it's absolutely fantastic. We have all new dental units. We have computers at every station. We have additional intraoral cameras. We have all digital radiography. And we also have a simulation lab where the students during lecture actually have a mannequin. It's just wonderful.
Of course, dental assisting is sharing the same wonderful facility. And we have come a long way. We started in a small room down in the basement. We expanded to the F wing, and now we've expanded in this wonderful renovation.
And in addition to the equipment and the great environment, how would you say Delta's programs are maybe different from other programs? What makes Delta's programs unique?
Well, we have very successful students on their board exams, employment. We have absolutely fantastic adjunct faculty, which in the dental hygiene program we have 16 adjunct faculty, and they are committed, dedicated, wonderful faculty. And I believe that that is what makes Delta unique, is that we have marvelous adjunct faculty members and support staff.
Once again, one of the things I want to add, we have three faculty, 3 team members in for dental assisting. One of the things that's wonderful is the support that the college gives us that we don't see when we talk with our colleagues out there across the state of Michigan. So I do want to thank Delta College for letting us expand it and be creative to help our students learn.
Dentistry has changed over the years. Can you tell me how that's affected how you teach the programs?
It has changed a great deal. There's much more technology involved in dentistry, and that's why we are so excited to have the clinic that we have now, because we have the technology to teach the students, and they will be prepared to use that technology day one of their employment.
Right. And Pam, maybe you can talk about how both the programs are very separate, dental hygiene and dental assisting, but how you work together.
We try to demonstrate on a daily basis how both groups work as teams in dental offices. We do a collaboration where Helen M. Nicholas volunteer dental site where the patients will come in, hygiene will do the prophies and the exams, the radiographs, and then volunteer dentists will come in, and our dental assisting students will then do restorative dentistry on those patients. Also, in the winter semester, our dental assisting students actually go into the dental hygiene clinic, and they will assist and work alongside the hygiene students in doing some procedures. So we demonstrate that right here, that we are working as a team. And I will also say that faculty work as a team, and we want to show that to the students.
Wonderful. I'm wondering if you would allow me to come into the class or maybe the lab session to learn more about what you do and what you're teaching.
That'd be great. Leanne, we're just going to show you how to use an instrument today, and we stay on the tooth when we don't go below the gum with this instrument. So we're just going to stay on the tooth, and you're going to want to use a pen grasp, and your ring finger is going to be your fulcrum to keep you stable, and you're going to rock that instrument and move it along the tooth, and this instrument's going to remove the tartar buildup that your patient has on their teeth. So using your right hand, and if you can keep that instrument as parallel to the tooth as possible, very good fulcrum, okay, and get it right on the tooth, and now rock. Rock a little bit more with it, very good.
When would students start doing this?
They would start using the instruments about 10 weeks into the program.
Really?
They first have to learn how to hand wash and disinfect and position their patient, and then they would actually start with the typodont mannequin and using the instruments at that point.
Very cool. Thank you for showing me.
You're welcome. Thanks for being here.
Okay, Leanne, what we're going to be doing, and the other class members are going to be doing today, they're going to be molding or shaping that particular tooth, the one that I showed you on the screen that looked like E.T., we're going to be shaping that out of the clay.
Okay.
So what we're going to do is we're going to try to turn this into this.
Okay.
All right?
Okay.
So one of the things we would probably want to do is start the root.
Right?
Okay. And you can see how the root is. We've already started to kind of take shape of the crown. So all those landmarks that we would talk about, how that front part goes back,
leans in.
and then we got a little point, okay, and that's the little cusp tip on the tooth, okay, and then on the back of the tooth, this is what makes it look like E.T. Can you see the little dots?
Okay.
Those are E.T.'s eyes, okay?
Okay.
I think it really something to good, so you got to make sure.
Where would this be in your mouth?
This tooth would be right down here,
Okay.
all right?
All right.
Right in the bottom. So what we're going to do, we've kind of got the root a little bit, and we've got that little cusp tip. Okay. And so now we've got to maybe create a little bit back here. Okay.
Well, thank you so much for letting us come
I'm so
in
glad
and
you
learn more
did.
about dentistry.
I love what I do, and I'd
dental
like to pass it
assisting.
on to the students.
All right. Thank you
Yes.
so much.
Thank you very much for stopping in